first of all, what is neurodegeneration? We all know that neurodegenerative diseases are currently incurable and they result in progressive degeneration and programmatic cell death of nerve cells or neurons. And such problems can cause movement disorders called ataxias or mental function disorders such as dementias. And this one category of diseases of neurodegeneration includes such diseases that currently have a major number of patients worldwide, such as Alzheimer's disease, with around 44 million patients worldwide in this moment, and Parkinson's disease, with around 10 million patients worldwide. So, with today's technological advancement, we can use this as an advantage on our side in order to integrate brain imaging techniques in such manageable databases in order to collect the data, study them, and get out results that could be used in the early diagnosis of neurodegenerative diseases. Such an approach is called neuroinformatics. So, what does neuroinformatics do? Neuroinformatics creates and maintains web-accessible databases for experimental and computational data, essential for understanding the nervous system and its normal function and comparing this to the neurodegenerative disorders. And for example, this would, integrate the atlases of brain anatomy, so normal anatomical brain images, along with images from the patients using different imaging techniques like positron imaging tomography, functional magnetic resonance imaging, electroencephalography, and so on. So what I did is I did a review starting from the year 2000 on PubMed, Wiley, and PLOS ONE in order to look into the literature for the studies done about this topic using the keywords neurodegeneration, neuroinformatics, and project. And the results that matched the criteria were 25 studies. So we're going to go through them. I classified them into projects and techniques. So first we're going to talk about the projects. We have the Human Brain Project. The Human Brain Project is one of the most famous neuroinformatic projects currently known nowadays. It originated in the 1980s, officially initiated in 1993, and it includes 6 platforms, including the Neuroinformatics platform. So the Neuroinformatics platform, what it does is it collects the data of PETs, MRIs, fMRIs, MEG, and EEGs of patients and controls throughout Europe. And currently, the Human Brain Project officially has published 76 studies. And this is the website of the project. We have another project called the Alzheimer's Disease Neuroimaging Initiative. And this one was it started in 2004, and it gathers the information of Alzheimer's disease patients in the United States and Canada, and comparing them to controls and to mild cognitive impairment patients. And the study started, as I mentioned, in 2004 with 400 subjects, that was with MCI, 200 subjects with early Alzheimer's disease, and 200 control subjects. The number of patients currently increased a little bit, and they have different versions now of the initiative, as we are going to mention later on throughout the presentation. And that's the website. And we have another project initiated in China called Small World Organization. Throughout their project, we can see that they got a result, let's say, in 2012, throughout the analysis of 155 fMRIs, they showed that there are significant alterations widely distributed across the brain throughout the temporal lobe, regions of the subcortical structures, thalamus, pallidum, and putamen, in Alzheimer's disease patients, as we can see here. And the results also correlated with the fact that the apolipoprotein E4 is related to such changes, which is a genetic relationship with the Alzheimer's disease development. Now about the techniques. For example, we have a technique called diffusion tensor topography. Well, the study on 25 patients with Alzheimer's disease in Taiwan, and the results showed that the Alzheimer's disease patients showed a significant reduction in the global efficiency due to significant alterations of disrupted topographical organization in the white matter networks through the just through the brain imaging analysis, as we can see here. This is the diffusion tensor image. Another technique is voxel-wise morphometry. Voxels are 3D, while pixels are 2D. So voxels are way more, let's say, efficient by today's standards. And this was using the Alzheimer's disease neuroimaging initiative. There are two versions of the program right now, 3T and 1.5T, which is the weighting of the image processing. And they showed that there was a global decrease of the gray matter in the heavier images of 3T, and the increase in the white matter in the lighter images. And this was used throughout comparing voxels, not pixels. Another technique is high-dimensional classification of structural MRI, and by the classification of the structural MRI, we can see that a high level of accuracy, sensitivity, and specificity was obtained throughout analyzing the gray matter compared to the white matter volume maps. Now, why are we doing this? The purpose of doing such a thing is to predict the evolution of the disease, or to early diagnose the disease. And in a pretty recent study this year, applied to 99 traumatic brain injury patients compared to 113 healthy controls, it was shown that there was a significant correlation between the age of the traumatic brain injury that was established upon the imaging techniques analysis and the actual age of the brain injury, which is pretty promising. So the conclusion is integrating such databases that allows access to different brain imaging techniques in order to study the data, compare them, and further predict as the time goes on. That would help us to early diagnose that would help in the early diagnosis, and at the same time would help us to understand more and more the neurodegenerative disorder in order to reach a suitable treatment at the end. And these are the references, and thank you. As for the educational activities, in this channel video for free, I've been making high school subjects tutorials since I was 16 years old, and I'm still making these tutorials. Also this year I started making tutorials about medical curriculum like anatomy, physiology, biochemistry, and so on.